Hello all, my name is Smita. I'm doing presentation in the current guideline for the adult immunization, which was number one topic, and I chose the CDC website. I did look at different resources, but I found CDC the most straightforward and easy to look at the guideline for. So this is the front page of the Centers for Disease Control and Prevention website, where it has recommended adult immunization schedule. The schedule goes by the age and by indications, and there are different printouts you can do for the patients in case if they want the information on the immunization schedule. For the immunization table, if you scroll down in that page I showed you earlier, you'll see different vaccines listed in there, and it does have ages, and the yellow means the recommended for that age, and gray is not recommended, and the purple color is for the recommended if they have other indications and risk factors. As you can see, the vaccines, it also explains if the vaccine is inactivated or live attenuated vaccine. For example, for the influenza vaccine, you can see that the live attenuated vaccine is only recommended up to age 50 and is not recommended after that. So it's very easy to read, and it also tells you how many doses, if they need a booster or not, for the vaccinations as well. So I just wanted to show you the purple side of the coloration, and it does say that how many doses they need if they have any risk factor depending on what kind of vaccine they are using. Which is also helpful to look at. And when you scroll down, or if you click on the vaccines on the left side of that table, you will go down to the notes area where it has more details about the indications and contraindications for the vaccinations. For example, the pneumococcal vaccination is indicated for the patients who are of age 65 and older. So it does tell you that PCV13, if the patient had PCV13 vaccine, they can have PPSP23 at least after a year of the PCV13 vaccine. So though that is for the indication, but there are other special situations that is explained in the note area as well, like the patients who are of age 19 to 64 can also have are also indicated for the vaccine if they have chronic medical conditions. So the PPSP23 can be given to the patients younger than 65-year-old with certain conditions. So that's another good thing about this, and it tells you if the vaccine has to be repeated or not after one time given. Another example I wanted to show was the influenza vaccine. So it does talk about the egg allergy, which is one of the most misconceptions people have, that they can't have vaccine if they have egg allergy. But it does tell you with this special situation, under the special situation of in the note, that if the patient has egg allergy, even if it's a more severe egg allergy, they can still have the vaccination under the supervision of the healthcare provider. So this could be a very helpful information for the patient as well. It does tell that with history of Guillain-Barré syndrome within the 6 weeks of previous dose of influenza vaccine is actually a contraindication for the influenza vaccine. So which is very clear information on what vaccines should be given and what is the contraindication for each vaccine. So there are vaccines in adult immunization schedule. So these are the trade names, the vaccines available in the market. So you can look at different vaccine, which one you can order and what doses you need. So the note area also has details on what kind of vaccines are needed in 2 to 3 doses depending on the brand of the vaccines. Like there is a variation in Hep A and B combination vaccine versus Hep B vaccine only. So you can refer back to that brand names when you order that. In conclusion, I think Centers for Disease Control and Prevention is a very excellent resource for NPs to look for guidelines for vaccination for adults. It also has for the pediatric patients. It is easy to access from anywhere, from any computer, and it's very easy to read as well, and it has detailed information on vaccine indications and contraindications. So I really think CDC is one of the best website we can go to refer to different guidelines we need, especially for the immunizations. Thank you.